Hello, everyone. My name is Arifa, and this is episode number 8 of our interview series, Doctor's Aspect on Healthcare. Today, we have a very special guest with us, Dr. Hindmarsh. First, I'd like to thank you for your help during this pandemic.
Well, thank you actually so much.
And secondly, thank you so much for taking time out of your busy schedule to talk to us. So let's begin.
Hey,
How are you feeling
great.
today,
Oh, sorry, what was that? How am I feeling?
Yeah, how are you doing today? Just in general.
Today is actually a good day. I've had a few bad days in January, a few struggles, but doing great today. Thanks.
Thank you for that. So would you like to begin by telling our viewers a little bit about yourself and your specialty?
Sure, love to. So let's see. My name's May Hindmarsh. I'm actually a board certified family practice physician, currently practicing in Oregon. I was born and raised in Canada. Grew up in a small little mining town in the Great White North, and basically was the first one in my family to go to university. A short version is I did my university education in Canada. I met my husband in medical school, got married 4 days after we graduated. We both did a family practice residency in Edmonton, Alberta, and actually then got recruited to move to the United States because of a shortage of primary care doctors. And so we have been living in the US since 1994. We came down here doing rural medicine, small town medicine, doing our own hospital patients, ICU, some obstetrics. I didn't do, my husband did, and basically raised our family. I'm now an empty nester mom with my children grown and out of the house, and I've switched over to urgent care, which I've been doing since 2013. No, 2010. Sorry, that was my husband in 2013. 2010. And just liking the acuity of urgent care medicine, missing my regular patients, and working in a multi-specialty group in the Northwest here. Oh, I can't hear you.
Sorry, now can you hear me?
Yes.
Okay, so you told us a little bit about where you were located and where you practice. So you've already mentioned that. So we'll move on to the next question, which is what really led you to pursue medicine? Is it something you always knew, or did something spark your interest?
Yeah, that's a big question. So when I was 10 years old, I believe that's about the time when I thought I wanted to do medicine. And there was a couple things that happened because I didn't have a lot of medicine in the family. One is I just had a giant love for sciences and math. I was really good at them as a kid. I got a chemistry set when I was in 5th grade. I would go into our basement and do this chemistry set and blow up things and do all kinds of experiments. And that just piqued my interest. I also just watched a few TV shows like Marcus Welby, and there was an emergency show on back then that I really liked all the doctors in there. And I read a book in junior high and high school called The Making of a Woman Physician. It was by Elizabeth Morgan, and she was a surgeon, and it just depicted to me a strong woman in medicine, and I thought, I can do this. So I did have some ups and downs and changes throughout my high school years. You know, I really wanted to explore other options. There was a lot of family pressures, and I'll be honest, to get into medicine. And so there's a bit of a struggle. And when I was in medical school, I got in really young, I was 19. And that's really young and early for somebody just to be going directly into medical school. I don't advise that, but that was my path. And I struggled. I didn't like it, and actually dropped out of medical school. I had a couple of orthopedic injuries from sports, and I took some time off to reassess things. I ended up going back in and joined the class where I met my husband, and I had some still struggles along my career path. I'll say that, you know, That's a long story. I'm giving you the condensed Spark Note version, but where I'm at today is a great place. I've worked through all of that. I've grown to love my career and I love what I do. So there's ups and downs. And sometimes, even though, it looks all rosy at the beginning, there's sometimes struggles. Is it the, path I want everyone to go through like I did? No, but that's kind of my story in a nutshell.
Yeah, that sounds really interesting to learn about how you went back to the same path that you began on, even though you had some shortcomings in the middle.
Right. You know what? It's interesting because I applied into pharmacy school at the same time and I got an acceptance into the College of Pharmacy. And a week later, my medicine came for my acceptance into medicine. And I thought, oh, pharmacy would be so nice. The lifestyle options would be better. I was a competitive athlete at the time and I knew that I would be able to pursue my sport and have the easier lifestyle of doing pharmacy as a career. But in the back of my head was a longing and a nagging of, if I don't do the pursuit and pursue this career that I always really thought I wanted to do, I would never regret it. I could always leave it, but that was like the big thing that made my decision at that time. So, yeah.
Mhm. When you know, you know.
Yeah, exactly. Exactly. And there's bumps along the way and that's okay. But when you know, you know. Yes.
Mhm.
Very good. I like that.
Okay, so let's move on. What are your thoughts on healthcare where you practice, and what are its pros and cons according to you?
Oh, that's a big question. So healthcare where I practice. So I've seen a wide variety of things. The area that we chose to come to and work, and both my husband and I, was a rural, underserved area. And we really liked small town medicine. We liked the big adventure of small town practice. Things have changed a lot because I'm almost into this 30 years now, right? So medicine has really changed. But um, there's, I guess, in doing small town medicine, the pros and cons would be we started off with a small group. The group is now grown. It's quite large. It's multi-specialty, big hospital system. But the nice thing about doing small town family practice is that you get to be a part of the community. You get to know your patients really well. You have an impact. You're living in the community that you're working, and there's that close connection. You're seeing people, day to day. You really feel like a family, and you really get to touch the lives of the whole family unit. I mean, you end up being, um, the physician for the mom and the dad and the children. If you do obstetrics, you can deliver the babies, the grandma and grandpa. You get to know the family unit really well. The cons of that are you living in a small town where everybody sees you and can know your business, and you sometimes can't get away from it. So there's been some really interesting stories where people will come up to you all the time. You can be in the Walmart or the grocery store and it's like, oh, I don't really want to be bothered, I'd rather be anonymous. So there's that. Life was really different. Call was really tough. It's changed a lot now. And even transitioning into the urgent care part of it in the smaller community, it's that part's different, but you still see people in town, and so it's hard to sometimes escape. It's nice to get away and go on vacation. So as far as what I've done, that's kind of my experiences. And I've recently, just actually in the last year and a half, moved to another community. So I drive 40 minutes and commute to work. It's a city of 200,000 people now where I'm at. And so no one there knows me really. I've met a couple people that it's a coincidence, but so it's kind of nice because you can be anonymous. So it really depends what you're looking for. But there really is pros and cons to both. And it just depends what you need, as a doctor and a lifestyle and as a person.
Mm-hmm. I totally agree with that.
Yeah.
So,
If you want to really like the big city and all the thing that the city culture has to offer, and you want to be niched down, then that's for you. If you like to just be out on giant property in the middle of nowhere or just rural and have that small town feel and close connection, and then there's different, not just family practice, but peds, internal medicine. You can be a small town surgeon, ortho. So yeah.
mm-hmm. So, how do you think that healthcare access can be improved?
Okay, that's a big question. That's a giant topic. That could be a topic for a whole day, right? How can
Yeah.
healthcare access be improved? Well, first off, let me just start off by saying I'm assuming this is for healthcare access for the United States. I mean,
Hmm.
having lived in another country, born and raised in another country with a completely different healthcare system, and also I've done mission trips around the world, some third world countries, and seeing access to healthcare there, and how things work. I guess the first thing I would challenge and say, my answer to that question is, what is your definition to, as far as access to healthcare? Is that assuming access is bad? Because not everywhere, has bad access. And for instance, where I'm living in the state I'm in, access is really easy. In Canada, in socialized medicine, access for the most part is pretty easy. Although, if you live in very rural areas of Canada, where there's hardly any doctors, access is tough. Even though everyone has coverage because they have socialized medicine, there's still access issues, right? Because of lack of physicians. And so we're pertinent to the United States in my region. I think healthcare access is a very regional thing. State-wise, it's very different because states run programs differently. So I guess I would unravel this big, like, tangled necklace or Christmas tree ball of issues as far as the access is. It's not quite so simple. I think in some ways people have really pretty good access. Does everybody have coverage? Maybe not. But man, there's urgent cares, on every street corner in a lot of places, just like McDonald's or your fast food place where people can get in. Sometimes rapid access also is not a good thing. That means I see people will come in with a sore throat they've had for an hour. And is that a good thing? Sometimes not, because then we end up doing a test right away, maybe for strep throat. That is a waste of money. Or people beg for an antibiotic that they don't really need, but maybe they should just have it because they're going away for the weekend and they'll feel better. And some doctors just want to give them medicine to go away. So that access, is that better? Not necessarily. I think the bigger question is, the lack of and disparity maybe in healthcare coverage for some people is maybe a bigger question. And there's to unpack that, and like, how do we improve coverage for people is a big topic. And like I said, where I live in my state, the poorest people are covered because of Medicaid programs. And the richest people, or the people who are employed, are covered because of insurance that they could privately purchase or through their employer. The people that get caught in the middle, where I live in my state, is actually the average middle income family, small business owners especially, because they are too rich to qualify for the Medicaid programs, and they don't have enough money to purchase their own private insurance. So they're the ones caught in the middle, and that is tough. So to answer your question in a simple way, I really believe from my experiences in growing up in a socialized system, seeing things around the world and here, is that we need to probably deregulate a lot of things so that we can allow people to have more choice, so the prices drop, so that there's just a direct connection between the consumer, which is the patient, and the provider, which is the physicians. And I think that the direct physician to patient marketing, not just marketing, but direct physician healthcare programs that a lot of physicians are now adopting, where they have their own business and they sell direct to patient plans for instant access to their doctor, is kind of like going back to the olden days and finding a way to have coverage for people for disaster coverage. I also think that There's some countries that have some pretty interesting systems, which is like a two-tiered system, so that you give basic healthcare coverage to all, so that nobody goes totally without in emergency coverage situations. But yet, if people want to choose to opt for a more premium program, they can get, tax credits for that and opt out and purchase through their employer or privately a sort of more premium system. So there's like almost a two-tiered system, but that's so that, we don't abandon everybody, but yet we have to think of costs when we say access for everyone. So that was a long answer, but it's very complex, as you can see.
Yeah, it's a very complex topic that could be talked about for hours.
Right, right. And I just find it fascinating because we have all these politicians, government officials, all these people in there trying to solve the problem. When I think most of it should just be handed over to the people doing the job, which is the people in medicine, as well as, the consumers, which is the patients. What do they think that they need, and what do the physicians think we can provide? And I think we do a better job of solving it. But anyway, I'm not a politician, so.
Okay, so now I want to take the discussion a little bit to what's going on in the world right now that we're
Yeah.
facing today, the COVID-19 pandemic. So how has the COVID-19 pandemic impacted you personally and professionally?
Okay, personally, huge on so many levels. So first off, with what I do in urgent care, we see in our group, the sick people, the walk-ins, and actually immediately in our group, we were furloughed and shut down. I was at home for 3 weeks unemployed till our group really figured things out. That was really bizarre. And then, a lot of colleagues in the same boat. We restructured things and got back to work. And so now actually there's a group of 12 of us that are doing the urgent care access, and we have become the COVID specialists. We've divided our clinic into what we call the respiratory clinic, where we actually see the sick people with any symptoms that are COVID, like fever, cough, sore throat, and we direct them there through our group, and separated out the healthy to the other group. So I feel like by default, I've had to learn a lot about COVID. I've been seeing a lot of it. And in my family, I'm seeing my father, who's 84 years old, locked up in his home, kind of afraid to go out or go anywhere for fear of getting it. My mother-in-law, who's 92, lives in an assisted living facility in Canada and has been literally locked in her room with her meals brought to her for like months at a time. And it is so sad and distressing. She got COVID. It went through their building at Christmas time, and there was 56 of these elderly people that got ill out of 80 some of them. Nobody died. It was like a miracle. A few went to the hospital, but to watch her suffer, and we could basically just FaceTime and phone her, be sick, has been really difficult. My sister's an ICU nurse, and she is an ICU nurse on a COVID ward, and she's been struggling with her, even just mental health, watching people be ill and die. And so I've been a support for her. So my kids have been stuck at home doing their university studies online without, being able to go out. So it's impacted me from my elderly family members to everyone dealing with COVID emotionally. It's tough. And I'm an introvert. I like to be in my home. I like to be away from people. But even me, having things locked down here in Oregon, especially, we're still on like high extreme levels where restaurants are still closed, gyms are closed. They were having people call the police on family members or friends who had too many people over for Thanksgiving or Christmas. I mean, it became very emotionally distressful, politically and personally. So it's been tough. And at work, we get it there too. As I said, being the one to do the what we call the COVID, the sick clinic, where we're seeing people with COVID and screening and telehealths, people are afraid. There's some people that aren't, and they're kind of more vigilante, and they're like, nope, I'm going to do it my way, my rights, so there's that extreme, which you have to listen to them and sort of coach them and educate them. And then there's the other people who are panicked and despair and crying, and that wears on you. But I feel really honored to be able to help people through this time, not just like, here's the rules about COVID and this is, I'm educating them, but just to talk them off the ledge and help them calm down and make them feel better and know that it's okay. We're going through a tough time. So it's just unprecedented. It's crazy. Yeah.
Yeah, I know COVID has been tolling on a lot of people's lives emotionally as well, with family members catching it and just being safe and being in your home.
Yeah, like I said, the community I live in is small, but it's sad because the mental health issues everywhere, even not just a small community, but large, has been a big problem. And there's been multiple suicides and deaths in kids and high school students who've lost their social contacts. They've lost their hope for life with their sports, and they're looking at college scholarships through their athletics that have been canceled. It has been really, really tough. Yeah.
Yeah.
And, there's no easy answers. Obviously, we had to do the best we can by shutting down the country and trying to get a grip on this, obviously. But man, you have to look at the social and economic impact, on people's mental health and their businesses and their friends. I've had friends' livelihoods taken away because of the closures, as well. And so, you want to help protect lives by shutting things down to help mitigate the virus. Yet you have to look at the actual numbers, and is what we're doing worth it? And so it's a really tough balance, and I sure wouldn't want to be the one making all those decisions, at the top of the chain. And it's become so political, right? Because one side, it's interesting how it gets politicized. It's funny how things follow, but one side says one thing, one side says another. And I really think we have to give grace to both sides, and, because both points are valid, and kind of come to a mutual meeting point. So.
I agree. So do you think the pandemic has affected the access to healthcare in any way?
Obviously, yes, at the beginning when, there's a massive shutdown and people are, having their elective procedures, emergency procedures stopped immediately. I think everybody, like, that was a panic thing. And I knew a few people that were undergoing some emergency surgeries where those were postponed. That was terrible at the beginning and frightening for people. And you were hearing of some of those horror stories. I think that the medical community itself did its best to try to sort things out over the first few weeks of that and ramp things back up as soon as they knew that hospitals were safe, and then they had plans and a system in place to keep it safe for people. Ultimately, now as things have unraveled and things are trying to get back to normal, I think a lot of patients are still afraid to go to hospitals, which is dangerous, and they're actually pretty, safe places to go. And we're telling people, don't, wait if you think you're having an emergency, crushing chest pain. It's okay to go to the ER. So we're encouraging patients that the access is good. And now the big thing is telehealth, right? We've seen that implemented on like a massive scale, to the point that, telehealth was a thing and really becoming a new popular thing for the past couple of years. But I think there's not one health system that hasn't now utilized telehealth in some way. And I did a poll actually on my blog post page that it was about 65-70% of people had used telehealth. Most people like it. There's some pros and cons, and actually I've done a podcast about it. But yes, I think access now is amazing, and I think telemedicine is here to stay. It's wonderful for so many things. It has its cons, obviously, but I think access now, for the most part, has improved. Yeah, we'll see how popular this lasts, but there's little tweaks to it, but I think that telemedicine has been revolutionized by this coronavirus.
Hmm. At least something good is coming out of the pandemic.
Well, that's the thing, right? When, if you look at any history of any kind of big black swan events, like the pandemic of the Spanish flu, the 1918 epidemic, what came after that with vaccinations and flu vaccine and treatments for pneumonia. I think things are going to come out of this new technology for the vaccine, the mRNA technology that's just, they've been developing it for years, like a decade, right, with the initial SARS. But now that it's been got the emergency authorization use, and now we're on a massive billions of people trial, right? That this technology might really be a game changer for not just COVID, but for targeted gene therapy, for cancers. Let's hope that, yes, we discover some great new medications and vaccines.
Okay, so now I want to talk about the COVID vaccine. So what is your opinion about the COVID vaccine?
So there's a few different types of vaccines available out there. I think I heard you had another guest on a few episodes ago, right? Sharing different how the vaccines work, which was great. So I won't get into the details of that, but right now what we have is the Moderna and the Pfizer vaccine available right now, which is the mRNA technology. There's a couple others still under trial, which are a little different, but this new technology, this mRNA technology, sparked a lot of interest for me, in my own knowledge of vaccines at the beginning. And I would say that at the beginning, I was pretty nervous because anything new in medicine, a lot of us don't jump on the bandwagon right away, whether it's medications. Some of us like to let it sift out and see what happens after a year or two that it's been out. But you can't really do that, right, in times like this. And so I was nervous about it at the beginning. I have personally a lot of immune problems. And I also was thinking, when the risk to a large population of recovery from this virus, is greater than 99.5%, and the mortality is so low, do we want to be putting in some new biologic agent into our bodies when we're healthy or immune compromised and we most likely will survive the virus? Do we want to be sort of experimental guinea pigs on this? But as I've come to know more about this technology, seen the trials, researched it more, and as it's unraveled as it's been given, I've sort of I've really changed my mind. I have become more educated as well. And I know that there's a lot of people out there that still have some reservations. There's a lot of conspiracy theories out there, and I would like people just to make sure they get good information. But I would say that I've changed my opinion. I did get vaccinated, mostly because I feel it's my duty as a physician to not be carrying something that I do for the flu and passing it on to my patients. I don't want to be an asymptomatic carrier, infect my patients. So that was part of it. And I really think that it's probably not going to impact my own personal medical problems with how it works. So I think it's a wonderful new technology. It's still experimental, but I think that it's looking to be really pretty safe for the majority of the population at large. And it's really the best thing we have at this point to contain this virus and get our lives back to normal, which is what we all want, right? So that's where I'm at with it.
So could you talk a little bit about about your experience when receiving the vaccine?
Oh yeah, it was really pretty easy. I figured it was just going to be like getting a flu shot or a tetanus vaccine. Where I went, it was really organized really well. I had the Pfizer vaccine. After the first, the first back shot, your arm's tender and sore. People forget, adults forget that most vaccines make your arm sore. We vaccinate our kids and they don't complain too much about cry for the first day. But yeah, it ached just like a flu shot or a tetanus. But then I did have a horrible migraine for the first 4 days afterwards. I didn't get a fever or anything like that, but I do have migraines and was having a really bad migraine month last month. My husband, he had no problem. So we got vaccinated the same day. The second dose we received is pretty much the same. It seemed to hurt a lot more going in. My arm was a little achy. And then neither one of us had a single side effect. We had no fever, no myalgias, nothing, which, then I was joking and said, I wonder if I'm building any immune response. I wonder if it's doing anything. But where I work, a lot of coworkers actually received the Moderna vaccine, and we're seeing a little trend that a lot of them were sick with and at home for 24 to 48 hours with a low-grade fever, a lot of body aches, flu-like symptoms. Seems to be, this is my own personal bias in here, the trend more with the Moderna than the Pfizer from what I'm seeing. But both of them can do this, and the response is really variable. So people should expect to feel a little bit achy, maybe have a low-grade fever. There are some extremes where people feel like they've just been hit by a bus and literally with the flu. But for the most part, people do pretty well within 48 hours. So if you're lucky, you'll be like me and have nothing happen. But I don't know. I haven't had an antibody test yet to see if I've actually developed any. So who knows? But it was really straightforward and fine.
Yeah, that's nice to hear. So I'm just going to end off by asking one last question.
Sure.
Do you believe that the education we're receiving on how to contain the COVID-19 virus is adequate? And do you think there's any information that you would like to emphasize?
The information, well, wow. I think that the information we're getting, if you're following reputable sources, let me emphasize that, right, is as good as it can be in this day and age with internet access. We've got, television media, the CDC and WHO coming out. We have internet access, universities, studies, trials around the world. We can access information as it's happening. So I think the important thing is to know where to get that important information. Follow reliable sources. Don't go to Facebook and follow, what somebody in town that's not even connected to medicine says. But I think the education out there is, it's tough because they are presenting this information, this brand new pandemic and virus as it happens. And it's frustrating. I understand that someone, even Dr. Fauci initially said masks aren't going to work. And now he's at the point where he's saying, we might need 2 masks. And, people get frustrated and they say, you said this, now you're saying that, you don't know what you're doing, you're changing your mind. But it's medicine, it's science, it's evolving. It's always, it's dynamic and always changing. And I think they're doing their best to keep up with the information as best as they know it as they study it more. So I would say to people, be patient, look for reputable sources of information. Don't get caught up in the politics of the information. And that would be, that's the best way to get good education.
Yeah, it's really important to make sure you're getting your information from reputable sources.
Right. There's always the, conspiracy theories things. And I think it's good for people to question things. Absolutely. That's what makes good scientists, is always questioning the status quo, right? Because just because, there's a herd mentality of doing things, it doesn't mean it's right. And that's where we discover new things. So I think questioning is great. I think being open-minded to both sides is important. I mean, scientists are always questioning and challenging things. There's just so much access nowadays for anybody. It's just look at reputable sources for your information. That's the best advice I could offer.
Okay, so that's all we have for the interview today. Thank you so much, Dr. Hindmarsh. It has been wonderful talking to you and hearing your thoughts on healthcare. I'm sure everyone watching will have gained some valuable knowledge from this interview. And lastly, I'd like to thank all the viewers for watching, and I'd also like to remind you to remember to stay safe. Thank you.